Hey, everybody. So today, thank you for joining us. I have Dr. Norris Little on with me again this week, Chief Medical Officer at Piedmont Newton, and we're going to get a local update. I think we've got some even better news from the last time that we met. Of course, here in Newton County, our kids have gone back to in person this week, so that's great news. And with that, Dr. Little, I will turn it over to you to let us know how things are looking here locally with our COVID numbers.
Great. Thank you very much. Hello, everyone. Glad to be with you and provide an update regarding the pandemic, especially as it relates to our community, and to answer questions that you may have. As you know, the information that we have around this illness is kind of constantly changing, and if you read through the media news, there are constantly new recommendations or new thoughts or new ideas. So I just hopefully can give you some clarification around those things. We've been very pleased that our inpatient numbers for patients with COVID have significantly declined over the last couple of weeks. We're probably down at least 50% over what we were, 2 to 3 weeks ago, which is great news for the patients, first of all, of course, but it's also very helpful in terms of our resources and kind of not being sure that we're able to provide the care that everyone needs that accesses the hospital for their health care. So that's good news. We've seen declines both in our ICU volume. We've seen declines in the number of patients coming into the emergency room with COVID. In my conversations with some of the physicians in the community, they've also seen declines in the numbers of patients that are accessing health care in general for COVID-related illness. So those are all, I think, a very positive thing. And I'm very glad to hear that students are able to go back to some in-person learning. And I know that's been a huge challenge and we've had conversations regularly with the administration of the school system just to try to help provide some guidance in terms of what we're seeing locally with COVID as well. We'll talk about a few things in terms of therapy for COVID. We're continuing to do monoclonal antibody infusions for COVID patients. That's indicated for patients that have not yet been hospitalized. It's effective in early COVID, so in the first 10 days of illness. If patients have risk factors such as over the age of 65, diabetes, hypertension, or some other, there's a list of qualifying risk factors for the patients to get monoclonal antibody therapy. And we are referring patients out of our emergency room, and our local physicians are also referring patients that meet criteria for monoclonal antibody therapy. And we really have seen that helps. One of the things that was happening early is that the patient would come in with early COVID. They weren't that ill. We would send them back out of the emergency room or back out of the doctor's office, and then 4 days later they're coming back and requiring hospitalization. And so what this therapy is preventing that from happening. So that's been I think a very good thing. And there are multiple. Piedmont has multiple centers in the metro Atlanta area where we're referring patients to get those infusions. So that's been a positive. We continue to use remdesivir on the inpatient side. And we have been using a drug called Actemra for a while. There's been some question about effectiveness, but a recent study just came out that said that it does seem to decrease the death rate with severe COVID. So we'll probably be using that medication more aggressively. From a therapy standpoint, there on the outpatient side, There aren't any other. We do use steroids, like Decadron on the inpatient side as well. That has been shown to decrease the mortality. But on the outpatient side, in terms of where we have data, really what we have is the monoclonal antibody infusion is helpful. Convalescent plasma, high-dose convalescent plasma may be helpful in early COVID. Multiple studies have been done now looking at hydroxychloroquine, and there is no benefit from using that medication. We'd all like to hope, a drug that simple would help, but I just haven't seen a single study, and none of the infectious disease experts that I know or the critical care experts that I know are recommending hydroxychloroquine. There are also some other. I like to always throw these things out on the table because people read about them in the news. But there's a antiparasitic medication, ivermectin, that's received some media coverage, and I do know that there have been studies approved to look at that, but we really don't have data currently that would support us using ivermectin. Now that may change as things constantly are changing with this illness, but right now we don't have any data to support its use. The other aspect is vaccination. So vaccinations are continuing to roll out. Piedmont, we have vaccinated both our healthcare workers, our frontline healthcare workers, but also we have been quite involved in rolling out vaccination to the 65 and older population within the Piedmont system. And so when we look at the disease right now, we have vaccination, creating immunity with patients. We have, of course, people who have had, everybody knows people have had COVID now. So there are many people who've had COVID, and that confers some immunity. And then I think we haven't had any big, holiday periods and travel and so forth. So we've seen the numbers, going down, which has been very good. Now, there's much media attention currently related to variants. So you may have and about whether you can get COVID again if you've had a vaccine. And so I think it's helpful to have some clarity around those two things. There are just multiple variants out there, but the ones that have gotten the media attention are the UK variant, has received a lot of media attention. It seems to be more contagious, and it also may cause more severe illness. I think that's still a little uncertain. And the other variant is the South African variant, and again, more contagious, and possibly may cause more severe disease. But what we are seeing is that vaccination, still, the current vaccines that we have do help prevent those illnesses from those variants. And if people get them, it may just they may get COVID, but if it's less severe disease. And I would tell you, this is true for all vaccination, or many of the vaccinations that we have. So when this rolled out and these vaccines say that they're 95% effective, that number is in a very narrow population of people. And so when we start, vaccinating millions of people, we're going to see some variation in that effectiveness, but that's to be expected. The other, out on the West Coast, I read the news, they've got 4 patients who've had the vaccine that developed, probably more than that now, that developed COVID. But again, all those patients had either no symptoms or very mild symptoms. So, in my mind, that means the vaccine is still doing its job. If it's preventing severe disease, moderate to severe disease, then the vaccine is doing, what we're hoping it will do. And so I think we have to continue to monitor the issue with variants. And I think that's being very closely monitored by the CDC. and others to make sure that vaccine effectiveness continues to be, it continues to do what we're hoping it will do. But right now, I still think the current vaccines are doing, what we're hoping for, and we continue to think it's our best option for helping move us forward out of the pandemic. So happy to. I mean, we currently our PPE status and so forth is fine. We don't have any issues with that, we can answer any questions that you might have or any other topics around the pandemic that people might have.
I think you touched on this a little bit earlier, thoughts on the hydroxychloroquine. And I think you said you didn't really see any studies that had supported it as treatment.
No, there have been multiple done. So, I mean, when it came out as, there's probably every other day I see a new study that is done related to hydroxychloroquine, and we just have not seen it to be effective in terms of the prevention or treatment of COVID-19.
Right. And then what about, do folks, I think we've heard a lot lately about wearing 2 masks or doubling up, or do you have any thoughts on the need to start wearing 2 masks?
So, we have not changed our PPE recommendations at the hospital.
Okay.
So I did see the information where there was some study that came out that, wearing 2 masks may be more protective. And of course, that, makes sense in some ways.
Right.
I wouldn't discount that, but, is it something that people will do? So if I have on 2 masks and I can't breathe when I'm walking up the stairs, trying to do the things that I need to do, then it's very unlikely that I'm going to comply with that. We have not changed our recommendations here. And I think I've mentioned this before. My bigger concern around is the kind of mask people are wearing. I see masks or the pull-up gaiter type things that are made out of knit material that is very porous. And, I think, personally, I think it would be even better if everyone wore the type of mask that we know, either, procedural masks, that you can buy, or the double layered, cotton cloth, woven masks, I think are the better option. And you can put a little filter paper in there with a paper towel or coffee filter or something like that. But I haven't seen any recommendation that we all need to do something different yet.
Okay. Yeah, I think it's still probably safe to say, as we said last time, just wear a mask. I mean, any mask is better than no mask, I guess, whether it's 1 or 2. So I think the important thing is just to have some sort of covering on. That's good. That's not necessarily that thin material like you had mentioned. What are you all seeing any folks coming in with any severe side effects from vaccines? I know this is probably not medically proven, but I know in my conversations with people that have had vaccines, my parents are both over 65 and had their 2nd dose on Saturday and had no side effects. But then I'm hearing some other people, especially maybe a little younger, that are having some side effects after that 2nd dose, which I think is a good thing from what you've said. That means it's working, not that it's not working if you don't have a side effect. But have you all seen anything severe?
We have not. I've seen some people who've had some other chronic health conditions maybe have a little more severe reaction. But I mean, the 2nd dose, especially in people who have not had COVID, there's a pretty high chance it's going to make you feel kind of lousy the next day.
Yeah.
I mean, I felt that. I mean,
Mhm.
for one day, I ran a fever, I had some body aches. The next day, I was fine. So,
Good.
and that's pretty common, So I'd
Mhm.
rather let people know, yeah, just that second dose, it might, the next day you may not feel so well. But it doesn't usually, I haven't seen it be persistent or people have
Mhm.
persistent symptoms, maybe
Yeah.
fatigue for a day beyond that, but nothing else. And that is indication of how the immune system is kind of revving up to fight the COVID organism. So that's not a bad thing. Although, if you don't, I've had people say, well, if I don't have symptoms, does that mean the vaccine's not working? And the answer to that is no. The vaccine, we have checked people who had no symptoms after the vaccine, and they still get elevated antibody titers.
Okay.
So it just is people's immune systems are different. People aren't the same, and you're just going to see some variation in there. So now, people who've had COVID and they get vaccinated, they may have a worse time with the first vaccine. So that we have seen as well.
Okay, that makes sense. Well, that's good to know that it is not out of the ordinary if you're having some reactions. It's good to get that information out. Mm-hmm. Yeah. Okay. Well, Dr. Little, I again appreciate your time, your dedication to the community and the health of our community, your assistance with the school system leadership and helping them navigate through this. And thanks for joining us today. And we will do this again in 2 weeks. So if you're watching and you have questions you would like to get answered by the leadership here locally at Piedmont Newton, please submit those in the box below the YouTube video. And we appreciate it, Dr. Little, and you take care, and we'll see you all in 2 weeks.
Great. Thank you very much. Have a good day.
Bye-bye.